Hello and welcome to the On Track Family Education Series. I'm Dr. Mary Marquardt, a neuropsychologist with the On Track team, and today I'm going to be discussing the cognitive symptoms of psychosis. So today I'm going to be focusing on the cognitive symptoms of psychosis. I'm going to also provide some information about what some of the challenges can be with having cognitive symptoms and discuss some of the supportive strategies that family members can use. As I mentioned, I'm a neuropsychologist, and neuropsychology is a subspecialty of psychology that specializes in both the assessment and treatment of individuals with brain-related illness or a brain injury. Here at On Track, we are two psychologists, a clinical psychologist who focuses on the emotional and behavioral changes associated with psychosis, and myself who focuses on the cognitive symptoms of psychosis. I provide assessment and treatment to clients. So clients who have cognitive complaints or cognitive symptoms as a result of their psychosis may be referred to me either by their psychiatrist or one of the team members for an assessment to better evaluate and determine what type of cognitive changes they've experienced. The assessments can also be used to assist clients with their goals, so either to return to school or return to work. So the assessments can be helpful that way. And I also provide treatment, a group-based cognitive remediation training program, which I will be discussing a bit more at the end of the presentation. So next, I'd like to talk about the different symptoms of psychosis. Symptoms of psychosis are categorized into three broad categories: positive symptoms, negative symptoms, and cognitive symptoms. And I'm using an iceberg diagram here to better illustrate the different clusters of symptoms. As we know with an iceberg, 1/8 of the iceberg is visible. It's usually above the surface. Whereas the remainder of the iceberg, it's hidden. It's hidden beneath the surface. And with psychosis, it's very similar in some ways. The positive symptoms are the obvious symptoms of psychosis. It's what people see when someone is experiencing a psychosis. Whereas the negative and cognitive symptoms are hidden beneath the surface, and it's what people may not see or what they may not realize. These are the not so obvious symptoms of psychosis. And in order to better understand the individual who's had psychosis, it's really important for us and as family members for you to understand and know whether they are experiencing any of these hidden symptoms. So let's briefly discuss what the different clusters of symptoms are. So the positive symptoms consist of delusions and hallucinations. So the delusions are firmly held beliefs that do not have a basis in reality. There may be the false belief of being persecuted, or maybe someone having supernatural powers, for example. Hallucinations can affect all five senses. So here people may see, hear, smell, taste, and feel things that are not really there. And most often the hallucination involves hearing sounds such as voices or noises. Positive symptoms also consist of changes and disturbances in behavior. So some of these changes may involve things like fear, being fearful, having mood swings, feeling very anxious, isolated. There may be a lot of confusion during the acute episode of psychosis. The individual may no longer be taking care of themselves. Their hygiene may be affected, their grooming, and there may be disturbances in sleep as well. Negative symptoms often appear before the positive symptoms. So you may begin to notice more withdrawal, perhaps, or less interest in activities in your family member. Because the negative symptoms are often not as obvious as the positive symptoms, they may be missed and not recognized as part of a psychiatric illness or part of psychosis. And so in young people, they may be confused with behaviors of a teenager or a young adult, for example. So some of these changes that we would see with the negative symptoms are social withdrawal and isolation. So your family member may be spending more time in their room or on their own. They may be not as motivated to pursue hobbies or perhaps lack the motivation to do schoolwork. They may be very fatigued and spending more time sleeping. They may have some problems with abstract thinking and problem solving, so some cognitive difficulties. They may have trouble with speech and initiating conversation, so they tend to be more quiet and withdrawn. They may also have difficulties with expressing emotion. And so in someone who previously, before psychosis, was outgoing and smiled a lot and was very expressive, after psychosis, that may change. And so they're no longer expressing, they're no longer emoting the expression, the emotion that they were previous to psychosis. Again, some other examples of negative symptoms. So not completing schoolwork, not spending as much time socializing or with family, dropping out of hobbies, jobs, sports, etc. Not as interested in relationships with others. And again, they may not be contributing to conversations in the way that they used to, and so they're not saying very much. In terms of the cognitive symptoms, so what occurs after psychosis is the decreased ability to focus and pay attention. You may see changes in one's ability to learn and remember new information, a decreased ability to quickly process and respond to information, as well as a change in their ability to think critically and flexibly, to plan, organize, and problem solve, also known as executive functions. So, what are the main cognitive difficulties seen in someone with psychosis? So, the first area of importance is attention. And problems with attention can manifest in different ways. So, for instance, you may notice that your family member may have problems with selective attention. This is where they have difficulty paying attention to one thing. So, for example, if you are having a conversation with them and the TV is on in the background, they may have difficulty blocking out the TV and any other distractions in the environment. Another aspect of attention that can be affected is divided attention. So here they're having difficulty paying attention to more than one thing simultaneously. So for example, if they're doing a task and listening at the same time, in a classroom environment, for example, that could be note-taking, where they're taking notes and listening to a teacher or a professor simultaneously. As well, they could have difficulty with following verbal instructions, or if there are multiple steps while completing a task. Here, where they would have to divide their attention, that can be more challenging. Another aspect of attention that can be affected after psychosis is sustained attention. And this is where someone has difficulty paying attention over extended time periods. So for instance, in a classroom environment where one has to maintain focus on a discussion or a lecture for an hour and a half or 3 hours, that can be very challenging. As well, when an individual with psychosis may be back in the classroom and they need to read textbooks or study, for example, they may have difficulty doing this over a long period of time and they lose track of important information. So what can you do as a family member to help improve attention? I'm going to provide some very basic strategies next. So in terms of helping someone with attention problems, one important thing is to limit the information to the span of attention. So what I mean by this is if you are providing any information, it's best to keep it simple, short, and to the point. If a person, for instance, is having problems with sustained attention, then providing too much information and a very long discussion may not be helpful. As well, don't expect the person to be able to complete multiple tasks at the same time. So, what I mean by that is that your family member, if they are experiencing some difficulties with divided attention, for example, they may not be able to complete multiple tasks at the same time. That may be more challenging. So, again, for someone who is back at school, it would be best for them to focus on one task at a time. So if they are studying, it would be important for them to be in a quiet environment without any distractions, focusing on one task and not trying to multitask. And also to be aware of the need to rest. So cognitive fatigue is important here. You may notice that your family member is needing more sleep than they used to, and that is okay. Um, they may be experiencing more cognitive fatigue as a result of some of the cognitive difficulties that they're having. And so resting, sleeping more, all of those things can be helpful. A few other guidelines for helping someone with attention problems may include minimizing distractions and organizing and simplifying the environment. So, minimizing any background noise, minimizing having multiple people speaking at the same time. That can be difficult for someone who has trouble focusing their attention. Minimizing any clutter in an environment, complex visual patterns. Individuals with problems with attention might be very distracted by uh, a lot of clutter or complex patterns, and overcrowding as well. So, too many people, overcrowding can also make it difficult for someone to focus their attention. In terms of someone returning to school or returning to work, there are accommodations that may be beneficial. So, for instance, having a note taker, someone else taking notes if the individual is having trouble taking notes and listening at the same time. So, that can be an accommodation. Sitting at the front of the class, for example, to avoid any unnecessary distractions. Use of a smart pen, so a pen that can record what is being said, can be helpful. Use of frequent breaks can be helpful as well. A smaller course load. For someone returning to work, there are specific strategies and accommodations that I may be providing to them as well, depending on where they work and what their environment looks like. So, for instance, a closed office as opposed to a cubicle environment may be helpful for someone who is easily distracted and can't pay attention. So next I'm going to talk about learning and memory. So learning and memory can be affected after psychosis. And you may notice problems with learning and memory if you notice that your family member is perhaps forgetting to take their medications as prescribed, or they're not able to keep appointments. So they're missing appointments either here at On Track or in the community. You may find yourself providing a lot of reminders, so reminders about important dates, about deadlines, and so on. Your family member may be forgetting instructions that you've provided or information or details about recent events, so they may be more forgetful. You may also notice that they have some trouble learning and recalling new information as easily as they used to. So, for someone who was an excellent student or had a very good memory and they could learn and recall new information, now that may be a bit more challenging. And what we do know about learning and memory is that it is the short term, the everyday memory that tends to be affected and not long term memory. So, what can family members do to help improve memory? So, some basic guidelines for helping someone with memory problems after psychosis include repeating information or providing instructions as needed. So, you may find yourself repeating information quite often or giving the same information over and over, and that's okay. It's okay to repeat the information if the individual needs it. If the reminders are beneficial, then that's okay. That's a good strategy. You may want to use calendars. So individuals could learn to use calendars on their smartphone. So if that's something they're not in the habit of, here at On Track, we can assist them with that. So using calendars, inputting appointments, important information, and so on can be helpful. Even having a big calendar at home, for example, where it's visible to the entire family and everyone sees what appointments are coming up. That can be helpful. That's another way for other people to provide reminders as well. It's another opportunity for your family member with psychosis to see the appointment as well. So seeing it repeatedly over time, over multiple days, and so on, can help them to better recall information. Put things in writing when possible. Putting things in writing is beneficial for everyone. So getting either the individual into the habit of writing down their appointments or inputting it into their smartphone, that can be helpful. Again, writing appointments and so on a calendar that's visible to the family can be useful as well. If a person is more forgetful, having them repeat or paraphrase what you just told them can also be another good strategy. So here, if you're providing important information, you may want to ask them to repeat it back to you, just as an opportunity or as a way for you to check that they encoded the information correctly and that they're remembering everything that you told them. So this is a good way to sort of check on that. Memory is difficult to remediate. So memory aids are very useful. So using things like electronic calendars or paper calendars, agendas, our smartphones, post-it notes, etc. All of those tools that we use to improve our memory on a day-to-day basis are tools that someone with memory difficulties after psychosis can use as well. Accommodations in school or work can be helpful as well. So accommodations are often things like a reduced course load, for example, using tools to assist with learning or remembering information. So using a smart pen or recording devices, study groups, and so on. As well, after psychosis, individuals may need to change how they learn and retain information when they're studying. So discussing and helping them to better understand how to change how their study habits can be helpful after psychosis as well. So we've discussed changes in attention and memory functioning after psychosis. Next, I'd like to talk about executive functions that can be affected after psychosis. Executive functions include higher order critical thinking skills that allow us to accomplish goals. It's the ability to absorb and interpret information and to make decisions based on that information. So this is what we refer to as executive functions. And executive functions, as well as other cognitive symptoms of psychosis, tend to be quite subtle for some individuals, and they're often only detected when neuropsychological assessments or tests are performed. And so with my assessments, I'm able to detect if an individual is experiencing any problems with executive function or attention and memory. Now, in terms of problems with executive functioning that may be present, if your family member is having trouble starting things independently, so previously before psychosis, they were quite independent, they had no trouble starting or finishing tasks, and now you're noticing that there's some change and they're not able to do this as well as they used to. You may notice that they're more inflexible with having routines changed. So prior to psychosis, your family member may have been quite flexible when plans were changed or routines were changed, but now they struggle with that. You may notice that they don't like to make decisions or plan ahead. So again, someone, in before psychosis, they were able to make decisions quite well. They were able to organize and plan their day. And now they're not able to do these things or do them as well. You may also notice that they're now doing things in a somewhat disorganized way or disorderly way. And again, that's a change from who they were before psychosis. They can appear lazy or unmotivated to figure things out. And it's important, again, to highlight that it is not that they are lazy or unmotivated to figure things out, but it's because of those hidden symptoms. If you remember the iceberg and the hidden symptoms of negative symptoms and cognitive symptoms, that is now interfering with their ability to be productive and to carry out activities of daily living. And problems with executive functioning may also include a person's inability to see their own mistakes or changes in themselves. And so their level of insight has been affected by psychosis. And this would be another example of problems with executive functioning. So what are some guidelines for helping someone who may be experiencing difficulties with executive functioning? One thing that tends to be helpful is for the individual to have a routine, organization, and more structure in their day-to-day lives. So with coming to on-track appointments prior to the pandemic, having someone come in for routine and daily appointments, attending groups, our different groups that we provide here, that helped to provide some structure to their day. So this is important. Having a routine set out for the day can be helpful. Again, providing assistance as needed and maybe helping your family member to organize their time, to structure their day can be something that would be beneficial. If they're having problems with thinking of solutions when problem solving, so they're struggling with problem solving, you may want to offer some guiding questions. So things like, what's the first step? How would you begin that task? What do you think needs to be done? What are the different steps that you would need to carry out the task? So giving them some support and providing them with some guiding questions can be helpful if they're stuck. Again, as I mentioned, structure can be useful. So having a schedule or list of tasks that they can complete over the day. So if you're at work, maybe providing a list, maybe putting it on the calendar in the kitchen or on the fridge, that may be a helpful reminder. If they're having trouble with more complex tasks or long instructions, breaking that down into steps for them can be useful. And as well, limiting choices. So if a person is having difficulty with decision making, don't give them too many choices. So for instance, for dinner, for example, rather than asking them a very general question of what would you like for dinner, try asking, would you prefer chicken or beef? Giving them two options. Sometimes clients tell us that it's easier for them if they have less options. It's easier for them to make decisions. I know personally for myself, when I'm given too many options, it's more difficult to make a decision. Having less options can be beneficial. And finally, again, if someone is experiencing executive function difficulties when they return to school or work, there are accommodations that may be helpful to them. So things like extended time for tests and exams may be an accommodation they can have. If it's taking them longer to read through information, to make decisions on a multiple choice exam, for example, what answer to pick, they would benefit from having more time. If they are having trouble with taking notes and they're slow in taking notes, then there are programs that can assist with that. On certain campuses here at university and at different colleges as well, there are tutors and learning specialists that may be available to help with planning and scheduling. So again, helping them to organize their schoolwork, their time, their scheduling, and so on. And there's also different software that can assist with organizing and planning of projects. So those are other recommendations and accommodations we can make. To access accommodation, students need to be registered with the Student Academic Center on campus. So whether they're in college or university, high school, there is someone or a center that will assist them with the accommodations. Here at the University of Ottawa, here in Ottawa, the department there would be SAS. At Carleton, it would be the Paul Menton Center. At Algonquin College, it's CSD. So every school has their own specific department that can assist with implementing accommodations for students. Students will also need documentation of difficulties, so that can come either in the form of a letter from their psychiatrist, a letter from me, a copy of their neuropsychological assessment that I complete. Any of those can help them to get accommodations. So next, I'd like to cover some frequently asked questions that I get when I do these presentations from family members, and I thought it would be really helpful for me to put them in this presentation in case you have similar questions. So the first question that I'm often asked is, when do the cognitive difficulties start? So after psychosis, when do the cognitive difficulties start? So even before the onset of the psychotic episode, family members may notice a change in academic performance. So grades may drop. There may be a change in a person's work performance as well, or there may be changes in personality that can occur before the psychosis. Students, again, teachers may report difficulties with learning. They may notice that they have more problems focusing and paying attention. Their grades may drop as well. There may be pre-existing difficulties that worsen before the onset of psychosis. So problems with attention or learning problems, learning disabilities that were pre-existing may worsen. And then the earliest cognitive symptom that the research literature shows is often problems with attention. So these symptoms may all manifest even before the onset of psychosis. Cognitive difficulties typically occur during and after the psychosis has occurred. So most individuals with psychosis, approximately 85%, will experience some degree of cognitive difficulty. So they may have one or more symptoms as a result. And it really varies from person to person. It's very difficult to know who will have more cognitive difficulties or negative symptoms and so on. The most noticeable will be difficulties with sustaining attention, being more distractible, having some difficulty with insight and awareness, difficulties with problem solving, and learning and short-term memory. Another question I'm often asked is, do the cognitive difficulties get worse over time? The cognitive difficulties in someone with psychosis typically do not get worse for most people. So over time, what we typically tend to see is that they either remain stable after the first episode of psychosis, or that we can also see improvement after the first episode of psychosis. We do know, however, with untreated psychosis, that pre-existing deficits may worsen and they can progress as well. Another question I often get asked is, it's been over a year since my family member had psychosis. They have improved, but they continue to have problems with everyday life, including a return to work or school. Why is that? So if you remember the diagram that I showed you with the iceberg and the positive, negative, and cognitive symptoms, we know that all three types of symptoms contribute. But the cognitive symptoms and the negative symptoms have been shown to contribute more to problems with everyday life. Okay, so these symptoms often interfere with a person's ability to return to their everyday functioning, return to school, return to work. They can also cause a great deal of emotional distress. And so it's important to recognize that the negative symptoms and cognitive symptoms, although they may not be as noticeable as those positive symptoms, they're still there and they need to be addressed. So again, just to highlight the different contributions of the various symptoms of psychosis. So we know that the negative symptoms and the cognitive symptoms contribute more to day-to-day functioning. So individuals who have more negative symptoms and cognitive symptoms tend to have more social and occupational dysfunction. So they have more difficulty with returning to their everyday lives. So returning to work, returning to school, formulating relationships and socializing, being independent and taking care of themselves and living independently as well. Another question I'm often asked is, are the cognitive deficits caused by the medications that my family member is taking? And this is a good question. So for years, it was believed that the cognitive problems were secondary to medications or other clinical symptoms, such as positive or negative symptoms, a lack of motivation, having a depressed mood, or being anxious. But now we know that this isn't actually the case. The medications are not the cause or the causative agent for the cognitive deficits. And we know this because cognitive deficits are there and they remain evident even when those mood symptoms or positive symptoms are improved, or if the medications are discontinued. So when the medications are discontinued, the cognitive problems remain. If the medications were causing the cognitive difficulties, we would assume that once the medications are stopped, the cognitive deficits will not persist, but they do. So rather, it's the illness itself that causes much of the cognitive dysfunction. Another question I'm asked is, can medications improve cognition? Is there a specific medication we can give to help my loved one with their cognitive deficits? With respect to antipsychotic medications, we know that these medications can help cognition to some extent. They can have some beneficial effects on cognition. However, they usually do not resolve all of the cognitive difficulties. And this is also true for negative symptoms. There are new medications, cognitive enhancers, that are currently in clinical trials and are being developed to specifically target cognitive problems in psychosis. Unfortunately, those medications are not currently available. Hopefully in the future, they will be. Another question I'm often asked is, if medication does not fully help with cognitive symptoms, then is there some other treatment available for my family member? And the medications, as I mentioned, are very helpful with the positive symptoms, and they can be helpful with some of the negative symptoms and cognitive symptoms. But we also know that psychosocial therapies are very important to the recovery of a person who's experienced psychosis. So here at On Track, we do offer a number of different types of therapies. I do provide a cognitive remediation training group for clients who've undergone an assessment with me and who have shown that they have some cognitive difficulties. They are welcome to attend the group. The group is a 12-week group. It runs once a week. And really the goal of the group is to teach clients some strategies to improve any areas of weakness that they may be experiencing, be it with attention, with memory, with executive functioning. And there is a lot of research to show that these groups, as an adjunct to medication, can be very helpful in improving cognition and daily functioning. Other groups that are offered at On Track include a cognitive behavioral therapy group with our clinical psychologist. So with this group, the benefits here are that it can help to address any distressing emotions that clients may have, as well as distressing thoughts, perceptions, or voices. We have a walking group that runs weekly. Thank God It's Friday TGIF sports group that helps with increasing level of activity and socializing as well. And there is a healthy lifestyle group that runs periodically as well. Currently, the majority of these groups are not being offered because of COVID, but hopefully in the near future we'll be able to resume in-person groups once again. And we know that these psychosocial therapies are very important to the recovery of people with psychosis, and they can also have indirect and beneficial effects on cognition. So although on the surface these groups may not be targeting cognitive deficits directly, they do have indirect and beneficial effects. Well, that concludes my presentation. Thank you for joining me here today. Hopefully I was able to provide some information about the cognitive effects of psychosis, some of the cognitive strategies that family members can use, as well of the importance of neuropsychological assessments in detecting some of these cognitive symptoms after psychosis, and as well how cognitive difficulties can lead to emotional distress and they can interfere with a person's ability to resume their day-to-day activities. Thanks again.